When I joined the Department of Health as Medicaid Medical Director 4 years ago, I was asked by the current director of the department, Dr. Brent Sherrard, to see if we could do something to help promote telehealth. We started out putting equipment into most of the hospitals around the state, but as to expand beyond that to other providers, we knew we were going to need a legislative model. So we went to the legislature and worked closely with the Senate and the House of Representatives, and they wanted us to create a private-public partnership, which we called the consortium, to promote telehealth using as much existing infrastructure as possible. The consortium was created because Wyoming is the 9th largest landmass state in the Union with the lowest population. We still qualify as a frontier state. We're not densely populated enough to qualify as rural. We have a shortage of providers, physicians, psychiatrists, pharmacists in the state of Wyoming, and they're very localized into our more urban centers. The need for telehealth is undoubted given our geography and population needs. We had multiple providers of telehealth who were starting to come into the state from the surrounding areas, but there was no coordination. And so the need to have a centralized coordination so telehealth would become a seamless service rather than saying, well, when you take a cell phone, you don't worry that you're calling someone who has a BlackBerry or if someone has an Apple or if someone still just has a landline. You just know you call this number and you connect to a provider or a person. That's what we're trying to accomplish with the consortium for telehealth. So the benefit to a primary care physician in rural Wyoming to using telehealth is profound because now they can reach out and tap into the expertise of specialists in areas that they may not feel quite as comfortable about. For example, I have a pediatrician who is reluctant to adjust the doses of psychiatric medications on a patient who had come to her on high doses of multiple prescriptions. Through the use of telehealth, she was comfortable with managing and actually reducing the numbers and amounts of these psychiatric medications. The benefits of telehealth to specialists is that many of them who do have outreach clinics, again, would spend half a day driving out to their outreach clinics to reach a small number of people in a very defined period of time. So, for example, a cardiologist may drive from Cheyenne to, say, Riverton to see 20 or 30 patients. Well, that travel time is time when they're not able to provide care, and the patients may have a more urgent need to be seeing the specialist rather than going in on just the day that doctor is doing the outreach clinic. Through the use of telehealth, a specialist is able to reach out at the time the patient needs to see the specialist, and the specialist is able to avoid the time and lost opportunities from traveling. The benefit of telehealth for our rural hospitals is that they would be able to reduce the number of cases they would need to transfer to the larger centers. When a hospital is able to keep a patient within the facility, then that revenue stays within the local community. Sometimes they are transferring only because they need to be able to reach out to a certain specialty which may not be on their hospital staff. And if that can be provided via telehealth, then they are able to maintain that patient. Patients benefit from telehealth in many ways. First, if they are, as an outpatient, having to travel 3 to 4 hours each way to see a single 15 to 30-minute doctor's visit, they've lost an entire day of work. If, on the other hand, it's a child who needs to see the physician, now the child not only has to leave school, but one of the parents loses an entire day of work as well. This is a tremendous drain on any family. If a patient is able to be kept in a local hospital, it's not just the patient that's involved, it is also the family who is concerned and supporting that patient. If that patient is then transferred from, say, a Lusk to Denver, the difficulty for that family is now compounded by the fact that they no longer have their home base and it's difficult to commute. The state of Wyoming benefits as well from the provision of telehealth within the state. In our Medicaid program, we bear the travel costs for patients and families who are enrolled in the Medicaid program. So anytime we can reduce travel expense, then that saves money for the entire state, which can then be spent on the expenditure of health care directly. There have been many studies that looked at the quality of care provided via telehealth. And every study has shown that care is at least equivalent and sometimes better. There was a recent study out of New Mexico looking at the treatment of hepatitis C. And what they found is they actually had better outcomes in the rural settings of New Mexico using telehealth because the patients had better compliance because they were not traveling. When you can say that the use of telehealth gets better outcomes in terms of viral load and clinical outcomes than a university setting in Albuquerque, that is a clear demonstration of the benefit of the quality of telehealth. What we've done with the consortium is we have developed a model that we have now demonstrated works clinically, it's economical, and it's effective. It is currently in place, and what we are now trying to do is to expand the visibility of the system, making sure that patients and physicians are aware that it's available. We are trying to increase the number of cameras and locations where the telehealth is available. We are trying to make it as simple and as seamless as looking up the speed dial numbers on your telephone and saying, I want to connect to this location.